Okay, so good morning once again. And for this particular session, we shall be discussing Rickettsia and other similar organisms. So for this particular meeting, um, we will actually expound on a very special type of bacteria. I say special because this is not an ordinary bacteria because this bacteria is classified also as a special obligate intracellular parasite. In fact, at the early age or the early time when this was first discovered, so Rickettsia, many microbiologists were actually puzzled at that time because they cannot really distinguish whether the bacteria are whether the microorganisms are bacteria or viruses. Okay, so uh, let me first tell you a story, a very interesting story of its discoverer. So um, Rickettsia was actually discovered by the scientist himself, whose the term Rickettsia was named after. So his name is Howard, or his name was Howard Taylor Ricketts. So he was born in February 9, 1871, and he died on May 3, 1910. So it was there was this interesting story why he died. Okay, so he was an American pathologist after whom the family Rickettsia and other Rickettsiales are named. So here's the story. While in Montana, Ricketts and his assistant discovered that the vector that carried the pathogen for Rocky Mountain spotted fever is a tick because before this time, many were actually puzzled what causes spotted fever in Rocky Mountain. And Rocky Mountain, I think, is one of the cities or one of the places in Montana. So in the Rocky Mountain, they have this wood tick called Dermacentor andersoni and some other species of tick, such as the American dog or wood tick, Dermacentor variabilis. Okay, so imagine these ticks, okay, though they are infesting dogs, they are capable also of infecting humans, particularly with the microorganisms that they're carrying. And so that's the reason why if we clean our pets, we are also protecting ourselves in some way. So it was not once clear what kind of organisms the pathogen was. Eventually, it was named Rickettsia, the first of the Rickettsiales to be identified. However, for decades, until electron microscopy and other technologies became sufficiently advanced, it was known whether Rickettsiales, it was not known whether Rickettsiales were bacteria, viruses, or something in between. Now, we are very sure and we have already established that they are known to be bacteria specialized for intracellular parasitism. So again, so when we say intracellular parasitism, meaning to say they live inside our cells. Okay, so this particular kind of bacteria would live inside our cells and they would really find it difficult to live out of our body. So that's the reason why Rickettsia is not easily cultivable. Okay, so in fact, culture is actually dangerous. So Ricketts was devoted to his research and on several occasions, he injected himself, imagine, injected himself with pathogens to study their effects. Wow. So I think Dr. Ricketts didn't have any knowledge of biohazard at that time or otherwise he was just so devoted with science. So the pathogen causing Rocky Mountain spotted fever, Rickettsia rickettsii, was named after him. So after this eponymous genus, the larger family and order were given their names. So in 1910, the year when he died, Ricketts became interested in a strain of Mirim. So when you say Mirim, this refers to to the families of rats. Okay, Mirim carrying typhus known as tabardillo due to a major outbreak in Mexico City and the apparent similarity of the disease to spotted fever. So days after isolating the organisms that he believed caused typhus, he himself died of the disease. So that's the reason why culturing of rickettsia is proven to be very dangerous because even the scientist himself died from the typhus fever. So that was the story of Howard Taylor Ricketts. So all Rickettsia are considered to be as an obligate intracellular parasites. So humans are accidental hosts and we are not sources of infection with the exception of the epidemic louse-borne typhus. So louse-borne typhus is kuto in Tagalog. Okay? So they are divided on the basis of clinical symptoms and epidemiology into the following group. So we have the epidemic, which is the louse-borne, and then we have the murine epidemic, or we consider them as the flea-borne, and then we also have the tropical scrub or mite-borne, and then we also have the spotted fever, and then we also have the trench fever. So how the organisms are transmitted? So through vectors. So what are these vectors? So these vectors are either ticks or mites. So if these ticks, and then we also have other groups of vectors, the fleas and the lice. Okay, so the first group, they transmit the disease through inoculation, direct inoculation, meaning to say you have to be bitten by these vectors for you to get infected. And then the second group of vectors are the fleas and lice. So you get the disease by whenever these vectors defecate in your skin, or sometimes when you crush the vectors in your skin. Because if you will be crushing fleas and lice in your skin, the organisms are actually found in their intestinal tract and it will be freed from their intestinal tract and will come into contact into your skin. So if you are familiar with the practices of Filipinos, yung nagtitiris ng kuto, sa ulo mismo, nagtitiris ng kuto, actually that's not a very good practice because if you crush the organisms, it will actually liberate the intestinal contents of the organisms, and these intestinal contents may even include bacteria. Okay, so that's how epidemic typhus will actually spread. Okay, so since they are obligate intracellular parasites, laboratory cultures require tissue culture or animal inoculation. So the Rickettsia are classified as energy-requiring parasites. So just like Chlamydia. So in part one, we've actually discussed Chlamydia, which is being an energy parasite. So Rickettsia are also classified as energy parasite for the very reason that they utilize the host cell ATP, although they can also generate ATP from the Krebs cycle, but they are also utilizing our ATP as well. So in all other respects, we are still considering them as gram-negative bacteria. And I have to say it with conviction, culture is dangerous. And the reason why I'm actually shouting because it has an exclamation point here. So the bacteria stain poorly with the gram stain, and it is not clear why they must grow within the eukaryotic cell. So perhaps the reason of utilizing the ATP of the host cell. Okay, so that is for the growth and metabolism of Rickettsia. So what are the members? So we have the following family. So under the Rickettsia, we have the Rickettsia and then the Orencia. Okay, so typical member characteristics. So they are arthropod-borne. Okay, so they are obligate intracellular pathogens. They can grow only in the cytoplasm of the host, primarily because they are obligate intracellular parasite. Primary hosts have minimal to no disease from the rickettsial infection. Okay, so what do you mean by primary host? Humans are accidental hosts. So we are considered to be as the accidental host. Primary hosts could either be dogs or murine or rats. So these are the primary dogs. So they have minimal to no disease from the rickettsial infection. Okay, so transmission of rickettsia via arthropods. So, so there's a possibility of trans-ovarial transmission. Okay, so arthropods are vectors and reservoir at the same time. Okay, so arthropods directly inoculate new hosts with rickettsia during feeding. Okay, so whenever they bite you, with the exception of Rickettsia prowazekii, because for Rickettsia prowazekii, arthropod vector is the body louse that can die of the rickettsial infection, and humans act as a natural reservoir. So it's the other way around for the Rickettsia prowazekii. But for the rest of the arthropods, they are actually directly inoculating new hosts with rickettsia during feeding. Okay, so let's discuss the first genus that we have for today. So it's the Rickettsia. So Rickettsia are short, non-motile, gram-negative bacilli and about zero point 0.8 to 2 microns by zero point 0.3 to 5 microns. So that's the dimension. 0.8 to 2.0 microns, that is referring to the range of the length. And then 0.2 to 0.5 microns, that is actually the width. Okay, so they cannot grow in cell-free media, meaning to say they have to grow inside, okay, a cell culture, and has been shown to grow also in the yolk sac of embryonated egg and several monolayer cell lines. So these are examples of cell culture. So the red stained cells are actually cells with live rickettsia. So the one that you can see here. Okay. So unlike ordinary bacteria, wherein they can simply grow in nutrient agar, in blood agar plate, but not for rickettsia. Three groups are actually based on the disease that they can actually produce. So we have the typhus group. So under the typhus group, we have the Rickettsia prowazekii and Rickettsia typhi. So it has an asterisk here because it says here it is considered to be as a potential agent of bioterrorism. Okay. Examples from the spotted fever group, okay, includes Rickettsia connori, and Rickettsia africae. And then we also have the transitional group. Okay, so this includes Rickettsia acari, Rickettsia australis, and Rickettsia felis. Okay, so these are the different typhus group, and the one that you can see here in the illustrations are examples of spotted fever. Okay, these are examples of spotted fever. Okay, the rashes of the spotted fever. Okay, and then we also have the Rocky Mountain spotted fever. So this was the first type of etiologic agent that was discovered by Dr. Howard Taylor Francis. So this is the most severe infection caused by Rickettsia rickettsii. Again, humans are accidental hosts, and as what has been discovered by Dr. Ricketts. So it was transmitted by dermacentor ticks, no? Dermacentor variabilis or Andersoni. So initially, patients would manifest flu-like symptoms, which may include fever, headache, myalgia. There would be a muscle pain, nausea, and vomiting. And eventually, rashes will appear. And these rashes are characterized by erythematous patch. So when you say erythematous patch, it means that uh, these are red rashes that may appear on ankles or in the wrist, and it may extend to hands, soles of the feet, but not the face. So ito pala yung rashes. So this is an example of the dermacentor ticks, which of course would appear differently if it's actually filled with blood. So another example, the dorsal view of dermacentor variabilis as shown under the electron microscope. So The disseminated Rocky Mountain spotted fever means that there is already vasculitis. So again, when we say vasculitis, we are referring to the inflammation of the blood vessels, okay? Blood vessels of the lungs, brain, and heart. And this is the reason why the disease is actually fatal. And since there is a flu-like symptoms, this may lead to pneumonitis, central nervous system manifestation, and even myocarditis. So vasculitis in the lungs leads to pneumonitis. Okay. Um, Vasculitis in the brain is the reason why there would be CNS manifestation. And vasculitis in the heart is the reason why there is myocarditis. So as a result, there would be decreased blood volume, hypotension, and disseminated intravascular coagulation. And the DIC, meaning to say, when we say DIC, there would be um, clot, small clot disseminated, okay, in various blood vessels of our blood. And perhaps this is the reason why there are rashes all over the skin because of the DIC. So, but the mortality rate is as high as 20% if the person is untreated. But it actually reduced to 3 to 6% once antibiotic therapy has been initiated. So the ideal antibiotics would include tetracycline and chloramphenicol for disseminated Rocky Mountain spotted fever. So that's the reason why it's very important at the time of Dr. Ricketts to know whether it is caused by a virus or bacteria, because if it's caused by a virus, then an antiviral agent should be given. But if it's caused by bacteria, then antibacterial therapy should be initiated. However, at that time, 1910, antibiotics have not yet been discovered. So that's the reason why many people actually died from Rocky Mountain spotted fever. And then we also have the Botonu fever associated disease. And these are caused by Rickettsia connori. So this one, it's actually the term itself is actually French in origin, and that's the reason why it is known as the Mediterranean spotted fever, which occurs in France, Spain, and Italy. So it's the reason why it's called Botonu. Okay, so stick-borne, and the reservoirs are also dogs and pigs. Okay, and then Rickettsia connori also causes the Kenya tick typhus, South African tick fever, and even the Indian tick typhus. So the name depends on the locale of the infection. So the clinical manifestation of the Botonu fever is similar to Rocky Mountain spotted fever, which means that rashes would involve the palms and soles of the feet and the body and that of the face. Okay, so it is also characterized by, I hope that I pronounced it correctly, tak noir. Okay, or kindly Google the correct pronunciation. But I'm sure with I'm not sure with this one, but I'm sure with this one. This one is pronounced as noir, tak noir, and noir means black in French, because it is characterized by black spots at primary site of infection in cases where the person is non-immune, meaning to say the person has not yet developed antibodies against this particular type of bacteria. So this is the black, okay, the blackening tacnoa. Organisms spread to the blood vessels in the dermis with damage to the endothelium. So secondary edema may result in local necrosis. Okay, so that's the characteristic of the Botonu fever. And then we also have the Typhus fever or the Typhus group. And the first in our list is Endemic Typhus. So let's differentiate, okay? Endemic Typhus is caused by Mirim Typhus. Okay? Epidemic Typhus is caused by a louse-borne typhus. So what do you mean by, di ba, in the parlance of epidemiology, when we say endemic, the disease is constantly present. So that's what we meant by endemic. And it is a Mirim Typhus, meaning to say the reservoirs are rats. So if rats are constantly present in a certain community, then the disease itself would also be constantly present. Hence the term endemic typhus. So this one is caused by Rickettsia typhi. Now, again, in the parlance of epidemiology, when you say epidemic, so it is defined as a disease that can easily be transmitted within the population in a very short period of time. So the transmissibility of the disease is actually higher than normal, higher than usual. So that's what we meant by epidemic. And the reason why it is called epidemic cloudborne is because of the fact that the reservoir itself is actually humans. Cloudborne, kuto. So, di ba, sa mga bata, madali lang mag-spread yung kuto. So, if an infected louse, if an infected louse will have the etiologic agent and it spreads from one head to another, then the disease can easily spread. Hence the term epidemic. Okay? So it is primarily found in Africa, Central and South America. So the etiologic agent is Rickettsia prowazekii. Rickettsia prowazekii is known as the Brill-Zinsser disease. So, unlike others, these organisms replicate in the cytoplasm of the host cell and can cause cell lysis. And whenever there is a cell lysis, the organisms will be liberated or released to infect another cell. Okay, so these are the typhus group. Okay, typhus. And take note that typhus is different from typhoid. Typhoid is caused by salmonella. Typhus is caused by the different species of Rickettsia. Okay, so again, so just so to give you an idea, epidemic typhus following infection from the human louse, the Rickettsia spread to the bloodstream and infect the epithelial cells of the blood vessels to produce headache, fever, and muscle aches. So a rash that begin and spread from the upper trunk. Mortality ranges from 40 to 60% of untreated adults. Okay, so that is the epidemic typhus. Now, for the endemic typhus, following infection by inoculation from rat fleas, clinical manifestations are similar to epidemic typhus, but they are milder, with mortality rate of less than 5%. And then we also have the epidemic louse-borne here. So we're giving emphasis that it's caused by Rickettsia prowazekii. And then the endemic Mirim Typhus is caused by Rickettsia typhi or Rickettsia typhus. So the Rickettsia enter the body from defecation on skin or whenever we crush lice and fleas into minor skin abrasions. So yun pala yun. So pag nagtitiris daw tayo ng mga kuto sa ulo natin, so nagkakaroon ng abrasion sa skin, and that's the opportunity for the bacteria to enter into their skin. So the Rickettsia are then phagocytized into eukaryotic cells and then break down the phagosome membrane by phospholipase A. So imagine the organisms can even multiply inside the cell, inside the phagocytic cell, in the cytoplasm of the phagocytic cell until such time that the phagocytic cell itself will lyse and the organisms will be liberated. Okay, so organisms are eventually eradicated by the host immune response. Okay, so this one is the Mirim Typhus. Okay, Mirim Typhus, so the vectors are oriental rat flea or the Xenopsila thiopis. So if you remember, Xenopsila thiopis is also the vector of Yersinia pestis. So the same vector. And the cat flea, Tenocephalids or Stenocephalides felis. So this is the cat flea. So reservoir are rat and transovarial transmission. So I've already explained what transovarial transmission is. So it occurs when flea defecates on skin or scratching infects the bite, and eventually, if there is already, kasi nga Makati yon, Makati yung bite, the site of the bite. So whenever we scratch the bite, okay, the Rickettsia typhi can also be transmitted from the flea bite. So that's the opportunity, because when you scratch your skin, there would be minor abrasion, and that would be the opportunity for the bacteria to enter. So symptoms would include fever, headache, and rashes. Like as you've seen here, now these are rashes. Okay, so that is the Mirim Typhus. And then this is the epidemic louse-borne, which I've already discussed. Rickettsia prowazekii, ito pala yung itsura ng louse-borne close up. So there are several vectors of epidemic typhus, no? We have the human louse, Pediculus humanus. Actually, if it's the head louse, we call it Pediculus humanus capitis. If it's a body louse, we call it Pediculus humanus corporis. Okay. Squirrel would also have three, so we call it Orcopias howardi. And squirrel would also have louse, so we call them Miohemotopinus sciuropteri. Okay, let me say it again. Miohemotopinus sciuropteri. Okay, so that's the squirrel louse. Okay, so it's a female head louse. Yeah, so this louse may actually carry epidemic typhus, the epidemiologic agent. So which is also known as the Brill-Zinsser disease. Okay, so transmission, the vector defecates and then patient scratches and the bite site via scratching. So the clinical manifestation is similar to Rocky Mountain spotted fever. Rashes affects the body, including the face. So the Brill-Zinsser disease is known as recrudescent typhus. Okay, when you say recrudescent, uh, it actually disappear. The symptoms actually disappear, and then it will suddenly reappear. So that's what we meant by recrudescent. So mild and rarely results in death. So this is the reason why we call it recrudescent. Okay, it lies dormant in lymph tissue, so it becomes inactive in lymph tissue and reactivates occasionally. Okay, so the patients with latent infections are an important organisms reservoir. So if the bacteria are just in the lymphatic tissue, they are just hiding or inactive in the lymphatic tissue, it doesn't mean that you couldn't be a source of infection. Okay, so these patients are important organisms reservoir. Okay, so let's discuss this time rickettsial pox. So rickettsial pox is caused by Rickettsia acari. So reservoir is the common house mouse. So may mga daga sa bahay. So they can be an important reservoir of rickettsial pox. And the vector is the mouse mite called Liponisoides sanguineus. Liponisoides sanguineus. So the clinical manifestation is also similar to Rocky Mountain spotted fever, except that you will notice here that there is a papule. Okay, so the papule will form at bite site, and eventually it will progress to pustule, and pustule will eventually become an eschar. And how would you know if it's eschar already? There is now blackening. So what's the difference between papule and pustule? Papule means it is as if that there is it's swollen, and then it is as if, and if you're pressing it, it is as if there's a liquid okay, inside that one. Eventually, it becomes a pustule, meaning to say there is already a pus or nana. And eventually, once this pustule is indurated, okay, becomes an indurate, meaning to say, nawala na yung mga pustule and then it will harden and then it is now called an eschar. So, other symptoms would include headache, nausea, and chills. So there will be a rash even on face, trunks, and extremities, but not on palms or soles. Okay, so that is the rickettsial pox. Okay, so let's now discuss another genus of the Rickettsia, and we have the Orientia. Another the Orientia, we have the scrub typhus. So scrub typhus is formerly known as Rickettsia chuchugamushi, but now we call it Orientia chuchugamushi. Okay, so the vector is known as the chigger. And chigger, the one that looks like this, is scientifically known as Leptotrombidium deliensis. So again, let me say it again. Leptotrombidium deliensis. And transovarial transmission in chigger is still possible. And where can we find chiggers? Chiggers are found in rats. Naku, talagang napakadami talagang dalang sakit ng mga daga, no? Okay. So, symptoms, again, you're familiar with this term already. There will be a tachynoia at the site of inoculation. And this is characterized by fever, headache, and rash that does not involve the palm, soles of the feet, or even the face. So there's no rashes on the face. So let's discuss now the laboratory diagnosis of rickettsial disease. So a while ago, I told you that culture is dangerous. So that's the reason why isolation of organism is not recommended on routine purposes. So you won't see hospital doing routine microbiological procedures isolating rickettsia unless that particular hospital is a research hospital. So if a hospital or if a laboratory would try to isolate rickettsia, it should only be attempted by biosafety level 3 laboratories like the one that you are seeing here in the illustration or in this photograph. So it means that you are in complete PPE and then you are processing it in BSL 3 laboratories in a negative pressure room. Okay? So it is highly infectious. Imagine Dr. Howard Taylor Francis even died. Huh? Dr. Dr. Ricketts, sino si Taylor Francis? Dr. Ricketts even died from from uh from rickettsial infection itself. If blood is attempted, specimens should be collected as early in the disease as possible. So these are the common rickettsial infections. And Will Felix test. What is a Will Felix test? So if you remember our enterobacteriacin discussion, um, Will and Felix found out that these people with rickettsia, okay, can actually excrete proteus in the urine. And then they associate proteus antigen to detect rickettsial antibodies. Hence, we now have the Will Felix test. So Will Felix test uses three types of proteus antigens. These are OX19, OX2, and OXK. And OXK is actually a Kingsbury strain of proteus antigen. Although Will Felix test is no longer being done. So it is already obsolete and we're just discussing it for the purpose of looking back at the historical perspective. Okay, so as you can see here, Rocky Mountain spotted fever will give positive reaction to OX19 and OX2. And Rocky Mountain spotted fever would have the same reaction with epidemic typhus and epidemic typhus. Scrub typhus will only yield positive result in OXK. Ehrlichiosis, rickettsial pox, um, trench fever, Q fever will not have any reaction with any of the proteus antigens. While Mirim typhus would be positive with OX19, but it is variable in OX2. So if you were asked, especially during the board exam, what is the most specific test to determine typhus fever? Never answer will Felix test. Okay, don't answer this one. So it is much better, okay, to use IFA, indirect fluorescent antibody test, because it may detect antibodies 2 to 3 weeks after the onset of infection. So this one is better. Okay, and this one is the more established and more commonly used diagnosis methods. So aside from the indirect immunofluorescent assay, we can also do the immunohistochemical and molecular detection. So in immunohistochemistry, sorry, in immunohistochemistry, okay, so the fixed cell tissue would expected to have proteins wherein the primary antibody will bind, and then the secondary antibody will bind at the Fc portion of the primary antibody. So the secondary antibody contains enzyme. So the secondary antibody therefore is enzyme link. And since it contains enzyme, substrate will actually react with enzyme. Because when we say substrate, substrate is a substance being acted upon by enzyme. And because of the interaction, there would be colored product. And if there's colored product, it means that the result is positive. Which means that if the person didn't have any antibody because he wasn't infected, he won't have primary antibody. And if he doesn't have primary antibody, you won't be able to see any colored product. So that's the very principle of immunohistochemistry method. So this one is more established method and safer for the diagnosis of rickettsial infection. Okay, so moving on to another family. So let us now discuss Anaplasmatazine. So the group members are Rickettsia, Anaplasma, and Rickettsia. Okay, so this is the Rickettsia. So Rickettsia also is an obligate intracellular arthropod-borne coccobacilli. Okay, so there are two forms and they are similar to chlamydia because chlamydia would have the reticulate and elementary bodies. Rickettsia would also have denser infective elementary bodies and reticulate bodies that replicate in the phagosome, okay, and prevents phagolysosomal function. So kapareho din siya ng chlamydia. Okay, so occurs in the multiplication of the cell. So it occurs in the phagosome. So this is the phagosome, for example, of host and leukocytes and other cells derived from the bone marrow, but not on endothelial cell cytoplasm. Again, when you say endothelial cell cytoplasm, these are just the lining of blood vessel. Okay? So dapat phagosome of the leukocytes, WBC, and other cells from the bone marrow. So a cell divides within the phagosome, so they develop mulberry-like bodies called morulae. So ito yung morulae. Okay? Morulae are round to oval clusters of bacteria, 1 to 3 microns in diameter. So ito pala are made up of bacteria inside the phagosome. So as the host cell ruptures, the morulae breaks into many individual elementary bodies which will continue the infective life cycle because bacteria will be liberated and now will infect another leukocytes. Okay, so that is the Ehrlichia. So that's another example of morulae. So these are clusters of Ehrlichia found in the phagosome. So Ehrlichia causes the disease known as the human monocytic ehrlichiosis, HME. So this one is caused by Ehrlichia chafensis. Though we also have Ehrlichia ewingi. Okay, so Ehrlichia chafensis and ewingi produce indistinguishable disease. So the natural hosts are dogs, deers, and humans. And the primary vector is known as the Lone Star tick, Ambilioma americanum. Lone Star is the symbol of Texas. Because Texas is a Lone Star state. So if you've been to Texas, you'll be able to see a single star that's part of their state flag. So perhaps Lone Star tick actually originated from Texas. So what are the clinical manifestations? Many infected patients are asymptomatic. So symptomatic disease would include fever, headache, malaise, and myalgia. So rarely present are nausea, vomiting, diarrhea, diarrhea, cough, joint pains, confusion, and sometimes rush. So there's also a possibility of leukopenia and neutropenia. Why? Because the bacteria itself are trying to to attack the very soldiers of her body. Thrombocytopenia or decrease in platelet count, elevated liver enzymes. So complications may include toxic shock like syndrome, CNS involvement, and acute respiratory distress syndrome. So to diagnose HME, so nucleic acid amplification testing is actually being frequently used for direct detection of Ehrlichia chafensis. So we can do the real-time PCR and multiplex PCR. So most cases of HME are diagnosed retrospectively by serologic testing, meaning to say, when you say retrospectively, um, patients have already developed antibodies. And since they have already developed antibodies, we determine if the patient had been infected before by detecting antibodies by means of indirect fluorescent assay. And the positive result is like this one, wherein you'll be able to see organisms that glow in the dark. And then we also have here the anaplasma. And anaplasma causes the HGA or the human granulocytic anaplasmosis, which is caused by Anaplasma phagocytophilum. Okay? And the incubation period is between 5 to 11 days with similar symptoms with that of the ehrlichiosis. So it is endemic to upper Midwest and Northeast United States. So somewhere in Texas, yung mga magkakatabing states doon. And reservoirs are deer, rodents, horses, cattle, and even humans themselves could be reservoir. So tick vectors are the reason why we get infected. So Exodus scapularis and Exodus pacificus. So these are examples of ticks that spreads HGA. So to diagnose, we can stain the peripheral blood and buffy coat. Do you know where the buffy coat is? Buffy coat is located in between the packed cell volume and the WBC. So morulae are found in granulocytes when present. So the sensitivity of the test is about 60%, and many patients have 1% infected granulocytes and present with leukopenia. So we can stain this by buffy coats. So other methods would include direct antigen detection, nucleic acid amplification test or PCR, isolation in cell culture, which could be expensive and dangerous. And syempre, the most practical is indirect fluorescent assay. So the purpose of the indirect fluorescent assay is to detect antibodies to the organism itself, Anaplasma phagocytophilus. And then we also have Coxiella, still part of the Anaplasmatazine family. Coxiella would have several unique features. First, there's only one species, and that is Coxiella burnetii. So they grow in cell-free media. Okay? Unlike Rickettsia, they can't grow in cell-free media. And should be considered, since they can grow in cell-free media, then we should consider them as facultative intracellular parasite. They're not obligate intracellular parasite. They're just facultative because of their ability to grow in cell-free media. So they can also grow in acidic environment, and acidic environment activates its metabolic enzymes. And the reason why Coxiella burnetii, the causative agent of Q fever, is virulent is because of their ability to form spores. And they're not generally transmitted by arthropods, unlike the previous bacteria that we have been discussing today. So Coxiella is not transmitted by arthropods. So Q fever is found worldwide. Okay, they are found worldwide. And the reservoir are cattle, sheep, goats, dogs, cats, deer, fowl, and even humans. So what predisposes us to Q fever is the exposure, okay, in veterinary uh, or animal handlers, veterinary clinic or animal handlers. So they are more predisposed to have Q fever. And Q fever is highly contagious, and we can also consider them as a potential bioterror agent. So the infection occurs via inhalation or dried birthing fluids of severe animals or ingestions of unpasteurized milk. So once a person is infected with Q fever, clinical manifestations would include undifferentiated febrile disease. I say differentiated because this fever is seen even in other bacterial infections that are related to typhus fever, such as high fever, headaches, myalgia, or muscle pain, arthralgia, cough, and rarely a rash. So other laboratory values would include elevated liver enzymes, increased ESR, and thrombocytopenia. ESR increases in inflammation. I hope that you knew that already. And then dissemination of bacteria. So many tissues may be infected, resulting in chronic disease. Cardiovascular system would be most susceptible. Okay, so ibig sabihin yung heart pala natin would be most susceptible in cases of Q fever. So to diagnose, we can actually do the direct fluorescent assay. So what's the difference between, although I will be discussing it in IS, but let me first distinguish to you the difference between direct fluorescent assay and indirect fluorescent assay. In indirect fluorescent assay, we are detecting antibodies. Therefore, the specimen for diagnosis would be serum. But in the direct fluorescent assay, we are detecting antigen or the bacteria itself. So the specimen for diagnosis are tissue samples. So therefore, DFA is used, direct fluorescent assay is used for the diagnosis of Q fever. And since it is a direct fluorescent assay, infected tissue samples are considered to be as the specimen, and you'll be able to see now specimen or bacteria that can glow in the dark. Okay? So nucleic acid amplification technique or PCR may also be used, but you have to use either Full blood or buffy coat. So culture is also dangerous. So culture only in biosafety level 3. But it says here, IFA method is the method of choice. Meaning to say, what's the difference again? In IFA, we are detecting patient's antibodies. If you're able to detect patient's antibodies, meaning to say the patients have been infected already with Q fever, but you have to wait for several weeks before you can actually do IFA. So the alternative method is the enzyme immunoassay. Kits are also available. So this one is more practical and cheaper. Okay, so that ends our discussion on Q fever. So thank you very much for watching and for listening.